We've had a tremendous surge in people reaching out to us with their stories from Quebec's healthcare system. Yesterday, we spoke to one woman, Robin. She told us the story of her 83-year-old mother and what she's going through in Quebec healthcare. We got bombarded with text messages based on that interview. Now, this morning, we have another story about what one Quebecer faced when they had to go to the ER. It's our pleasure to welcome Jasper Simon onto the program. They wrote in regarding their healthcare story. Jasper, thanks for coming on the show.
My pleasure. Thanks for having me.
So, Jasper, you were faced with a trip to the ER. Why don't you tell our listeners why you were faced with that?
So last Monday, I was at work. I have a typical office job, and I had a sudden surge of back pain and a sort of loss of sensation in my extremities, which, concerning,
Mhm.
as one should. And I decided to go to the ER at the Shin downtown, and the very nice, very transparent triage nurse told me that the approximate wait time would be about 15 hours to see someone.
Wow.
So at that point, my partner and I made the sort of unorthodox decision to drive to Ontario and see if we could get ER care faster in a different province.
Can I just tell you to echo that time frame?
Hmm.
Unfortunately, this summer I ended up at the ER at the SHUM.
Hmm.
In the middle, and I went. I took an ambulance trip to get there,
Hmm.
and it was a 15-hour wait. That's how long it took, by the way. So that 15 hours probably very, very accurate. Okay, tell us about the decision where to say nope, not going to wait. Let's go to Hawkesbury. Tell us how that played out.
So the two of us had waited in the waiting room at the Shin for 2 hours, deciding what our game plan was going to be. And at some point, my partner said, "You know what? I have a friend that went to Ontario and was seen in a matter of a couple of hours. I unfortunately have the experience of having to wait long wait times at ERs in Montreal because of health conditions that I have, and I work at an ER at a hospital on the island. So unfortunately, I'm a little too accustomed to very long wait times." And we were concerned that the loss of feeling in my extremities would become something permanent if we
Hmm.
waited for too long.
Wow. Okay. So you get in the car and you go.
Mhm.
How'd that go? Tell me about the drive there, and then what happened when you get to Hawkesbury.
It was a bit stressful, just because this was the first time that we were attempting anything of the sort. It was late at night. I think we got to Hawkesbury about 1 o'clock in the morning. We were even pulled over by cops temporarily because we supposedly went for a yellow light. So
Wow.
it was not a very smooth experience. But once we got to Hawkesbury, it was about 1 o'clock in the morning. We didn't even think an hour was that long because in Montreal you can drive for an hour and still be on the island.
Mm-hmm.
you know.
Yeah.
So we got there about 1 o'clock, and I'd say by about maybe 4 a.m. we were brought back by the nurses and started, the blood tests, the heart monitors, all of that. So really within 3 hours, I was already being seen by a nurse.
How far does the RAMQ Quebec healthcare card get you there? Do you show that and everything's taken care of, or do you have to pay out of pocket first and then you're reimbursed? Tell me about that side of things.
So it is completely covered because it is another provincial healthcare card. So same if a Ontario person were to come to Quebec and had to be seen at the ER, it would be entirely covered for the hospital stay. So nothing is paid out of pocket.
Jasper, tell me about the care you received in Hawkesbury at the end of the day, how long it took, all said and done, and getting discharged.
It was a fantastic quality of service. It was done quickly. Everybody was super empathetic to my situation. And all in all, it took less time to drive to Hawkesbury, be seen, treated, discharged, and come back to Montreal in less time than it would have taken to be seen at the ER at the Shim.
And significantly less time?
I'd say all of those things combined, it took about 11 or 12 hours
Mm.
compared to the 15 hours it would have taken just to be seen initially at the Shim's
That's
ER.
that's right. 15 hours just for the wait time there on the Quebec side of
Exactly.
things.
Exactly.
Jasper, you listen. You seem to have experience in care in your work, so I'd love a thought or two from you as to what you think we're getting wrong. Is it just not having enough bodies? Is it efficiency management? What does your gut tell you on that?
I'd say because I've been working in a hospital setting for the last 2 years, I'd say the main challenge is the lack of personnel, the lack of resources. I do believe that the numerous cuts in funding for healthcare across the province have had very serious repercussions on the Quebec healthcare system. There were some peak points, I'd say, beginning of this year in February, where we had such a lack of beds and a lack of personnel at the hospital that I had some patients waiting up to 80 hours for a bed at the hospital.
Would you? No, I don't want to start like a cavalcade on Highway 20 and people rushing to get out there, right? Whenever they have a problem.
Mhm.
But would your advice to be to people who are facing something semi-serious? I mean, thinking about a trip to the ER, would you be someone who's advising people? Yep, go to Hawkesbury.
I'd say to take a step back and think critically about your situation to see if it warrants going out of your way. Because, again, I did have the privilege of having a friend with a driver's license to bring us, and it wasn't a immediate life or death situation. I'd say if it can wait to see a doctor in a clinic somewhere on the island and it's not a pressing matter, I'd say wait it out. And on the opposite side of the spectrum, if you do believe that it is a imminent heart issue or brain issue, I'd say don't take your chances. If you do have that privilege to be able to travel elsewhere, I would unfortunately consider it. I'd say it really depends on the situation. Thankfully, in my case, it ended up just being a case of pyelonephritis, which is a kidney infection. So I was able to leave with pain meds, nausea meds, and antibiotics. So thankfully, in my situation, it wasn't life or death, but
Oh, that's good to hear.
and thankful that it didn't come to that point.
Well, that is certainly good to hear, Jasper. Listen, getting lots of notes on our discussion here right now. I have one person saying, "Hey, please tell Jasper to that mum's the words. Montreal is overrunning our hospitals. So I think there are people
Mhm.
that are out there in Hawkesbury that don't like the thought of more Montrealers heading out there. But I also have another listener that did exactly what you did and was seen within an hour of arrival. So many
Mhm.
stories here. Jasper, thanks so much. Thanks for reaching out.
Thank you. The pleasure is mine.